This year, 654 Americans have died in officer-involved shootings. About 111 of those killed were African American.
While race is often discussed as a factor, experts say many of those who died also had mental health issues. According to government statistics, a person with an untreated serious mental health illness is 16 times more likely to be shot and killed during an encounter with police.
In Grand Rapids, police say about a third of their daily calls involve someone with a mental health issue. And because of that, there's a new effort to address the problem.
13 on your side's Carla Byron explains how police and social workers will soon have a more efficient way of helping people in need.
Sergeant John Witkowski is a crisis intervention team or CIT trained officer with the Grand Rapids Police Department.
Probably the calls that we respond to on any given night, 30 to 35% of those calls has some mental health or substance use crisis.
CIT officers call mobile crisis response social workers to their scenes. But since the social workers work throughout Kent County, their response hasn't been quick enough.
The lag time, the time from when the call comes in and the officer gets there and the time that the social worker shows up could be anywhere from 20 minutes to much longer than that.
Precious time the team could be using to help someone in crisis. So in response, the city is looking to contract 4 to 6 social workers who will be solely dedicated to calls of crisis in the city of Grand Rapids. They'll be contracted through Network 180, a mental health service in the city.
Being able to actually contract with partners who are providing the services like Network 180 is going to be hugely beneficial because I can assess, but I can't get them into treatment because I don't work for Network 180. So being able to get to the root of it and be able to combine forces, it's going to be really great.
The officers and social workers would co-respond during peak times of crisis, 11 a.m. to 11 p.m. And the hope is they'll work 7 days a week.
We want to diminish those 911 calls. We want to get that person where they need to be. We want to increase those outcomes and utilize our resources more optimally.
In Grand Rapids, Carla Byron, 13 on your side.